How do we share resources in such a way that we can be able to tackle the problems of poverty and marginalization?
Article 2 or 3 of the Constitution mandates the Commission of Revenue Allocation to develop a criteria for equitable allocation of revenue to the two levels of government as indicated by our chair.
The formula has 6 parameters. The money is allocated based on how the population, the number of people in a county, the levels of poverty, the poverty depth. How far away is the population in the county away from the poverty line? It also allocates money for land area, and that is 8% of the kitty, 45% on population, 18% of poverty. Then we have what we call the fiscal responsibility parameter. This takes 2% in that formula, and the idea here was to try to incentivize counties to correct all the revenues that they could. So a county that corrects more year on year benefits from that 2%.
CRA's work around dealing with inequalities and how to think and rethink how we share revenue as a country comes in very handy. The policy makers are in government. So this year we've tried as much to bring in those policy makers into the room so that they can also, be part of the discussion, but at the same time they can get to hear some of the challenges that county governments are having, civil society and the development partners, but at the same time to try and connect it with how can government policies start responding to those gaps.
The main challenge we are facing is the inadequate resource that is available, that is set to cost for these particular functions. If you look at the current formula that is being used, one, the base factor is the revenues that we are facing, our resources or allocations that goes to county governments are based on the audited accounts of 2013. Remember, since that time, the total revenue collected nationally were below $1 billion. But as we are talking now, it's more than 1.5 billion.
The Constitution said, base it on last audited and approved accounts. This gives Parliament a leeway not to approve audited accounts.
A case in point is RMLF. That's a road maintenance levy fund. We have in cases where some particular road can be given funding by the county government and the national government because we are not able to really read from the same script. Another issue that we are facing is when we are using some statistics which are outdated. At the moment, I think we are using 2009 Kenya National Bureau of Statistics census results. Otherwise, if we rely on these old statistics, where you are told Baringo has a population of 555,000 people, yet most of us have worked hard to marry 3, 4, 5 wives, you are actually lying to us because we've really improved in terms of expanding the population in the county.
Costings or functions. In Uasin Gishu, we have a unique situation where we have 4 former local authorities: Uasin Gishu Municipality Council, Ban Forest Town Council, Wareng Town Council, and Taribo Town Council. Those authorities, the staff that were employed in those authorities, they take 47% of the personal emoluments.
For example, a function like L, we only have 1 staff in every dispensary. You cannot take that staff who was doing, who was working in a town council to go and work in a dispensary because you need to employ an elder staff to work in a dispensary. So you'll realize that most of us, we are challenged. We cannot employ qualified staff who are supposed to provide services to our people, and yet we are still paying people who don't add any value to their counties.
Is that the formula that's being used? If you look at the indexes that are being used in the formula, one of it is population. But if you look at population, it has never addressed very well the issue of migration of population. There's another aspect of poverty index. We on and on, we've been trying to raise to CRA to look at this. As one, either that we need to look at a way of increasing the equalization fund, and increasing this equalization fund, we need to look at the approach and the structure of this equalization fund so that we're able to identify the regions that actually need the equalization fund, The current setup, we are basing on counties, and we've classed some counties as though they don't qualify, just by virtue of certain percentage of their population are deemed or are perceived to be in a well-off wealth-wise.
Things that have been introduced by CRA, like a development index. Those who benefit from development index are basically counties that used to benefit from political position.
We actually raised some concern. I'll just mention it in point form. One was allocation of funding on ward level. Another one was poverty, especially for the squatters. We also have land historical injustice. Road network also is still a problem. There was also another case on
Make it the last one.
access to education.
Kindly, I needed to make one question to CRA. Do you have any monitoring system towards the allocation of the funds from the county to the ward, or some few cartels benefits from the same allocation that you give to those people?
The criteria looks very okay. I have no problem with it. But it doesn't get devolved to the county level. If you choose a ward in Elgeyo Marakwet that is, you have said this is very disadvantaged ward, how do you come and make sure that money reaches there? Most of the counties don't have enough money even to pay salaries. So that criteria becomes useless as soon as it reaches the county, because the priority is to pay salaries.
Issue that came out very prominently was the issue of the formula that is being used to share the revenue, because you realize that we need equity. And even when you look at health, you'll realize that health, most of the funding remains with the national government. So we don't have those funds in the county.
These counties, I think we are putting them into more pressure to overtax the already taxed population. Because you tell them this is your target, or maybe they say this is our target, we want to raise, they go down to the people to tax them from the chicken and everything, so that CRA will appreciate them.
In demographic studies, places that are civilized, that is where people are rushing to. Places that are having hardships, that is where people are running away from. So if you use a population kind of criteria and give it more weighted factorial loading to your consideration, then you are creating a bigger problem than you will be solving it.
The issue of urban poverty, it is happening in the old towns, but I can bet you in Iten now, we are developing those low-income estates. In West Pokot, we are developing those low-income estates. So how do we have a plan so that before those low-income estates come up and become a problem after 5 years, we resolve that and have a plan in advance to resolve that problem, so that we grow with a plan in mind.
Revenue allocation, you find that it is very difficult for the local mwananchi to understand and to participate. What is it that the Commission is doing to bring this knowledge clearly in the mind of the local people to understand their right when it comes to revenue allocation? Because our people are still using those old mentality that even the revenue that is allocated to a ward is being misused by those people who are in position.
Usawa si mbaya, lakini pesa yenye wanapeana ni kidogo sana yenye wanapea county. So ilikuwa mzuri kama wange at least wapeane hiyo pesa ya kulingana na vile county iko. Ndio at least hata hiyo usawa watu wakitaka kupewa services. So itakuwa ngumu wapewe hiyo services, we say ni usawa, lakini pesa hiyo ni kidogo. Wakitaka kukawa ni kidogo, at least hiyo usawa haitakuweko, kwa sababu kuna penye itafika na penye haitafika. Wataangalia kwanza kuwa ni gani ndio first priority, ndio wasaidike.
Can we adopt a manner or a formula whereby we're able to identify right from the ground areas that requires equalization fund? Because today, if you give me a small envelope, I'm just going to distribute equitably in a manner that every region of the county will be able to feel it. But there are some other levels of county areas and regions that requires further attention to look at the education aspect, to look at the food, stability of food supply to them. Health matters. Even roads alone, infrastructure in that place is still poor, just because of their geographical region. That if I decide today to allocate enough resource, I will deny the other region, and it will not be in order.
Principles of devolution is that finance should follow function. The money a county gets is to discharge the functions that a county is given. And which functions are county given? It is to deliver health care, it is to provide services in agriculture, in water, to do roads, class D and below, and a few other functions. So the question you want to ask yourself is, if finance follows function, what is a good proxy measure for health service needs? What is a good measure for the needs for health? What is a good measure for the needs for agriculture? What is a good measure for roads development and maintenance? And that is why the commission decided, in the absence of a very good estimate of what it costs to deliver health, let's use population, because that tells you how many people demand health care. That tells you how many children need immunization. It's not perfect, it's not good, but it is an estimate of the cost of service delivery. And it takes 45%. But out of 45%, what is the balance? There's another 55%. 55%, if you look at the other indicators in the 55%, they're supposed to make sure now that the counties can now, those that are lagging, can invest and look as nice or catch up with the others. Because 45% is an estimate of how much you need to give health, to give water. Then land area is a good estimate of how much it will cost for you to do class D roads. Poverty is an estimate of how much you need to come up with programs that are pro-poor. Yeah, to make sure that even those deep inaccessible places can be opened up. So these were proxy measures for need. So for the basic equal share, the commission was estimating how much a governor needs to run his office. It is not a measure for need of past service delivery. It is asking how much does Governor Tolgos need to run his office, pay his cabinet, and pay the few other workers. And that is why we as a commission have a problem with increasing that amount, because it is not based on a function.
Internally, we're able to have a deliberate focus and attention through other internal policies that we have, so as to address the issues of marginalized communities.
In Elgeyo Marakwet, we have a formula or an act called Equitable Development Act, which takes 60% of development money to all the wards. And I think looking at Elgeyo Marakwet in terms of what we receive from CRA, if we could just sit at the county level and allocate these funds, maybe we could be having a lot of problems now in our county. And one of the things that we did was to do a lot of civic education and public participation, so that the people are aware about the money which comes to the county, what goes where, and then now involve them in deciding which projects. And again, it's not only that we involve them in choosing projects, because first of all, what county does is to develop a CIDP. So that CIDP will be the guideline, so that when a certain ward are allocating resources to projects, they must pick projects from the CIDP. And I think for now, all the counties have developed the 2017-2022 CIDP.
The CRA now went away from focusing in allocating counties for equalization fund, and rather going to the sublocations. So the same applies for now for internal policies that counties will formulate, and the laws they will enact. Let all the decisions relating to allocation of resources be informed by the data and the statuses of the wards that they come from.
Katika Elgeyo Marakwet County, nataka nishukuru county kwa sababu ukiangalia katika hospitali yetu, saa hizi mambo ya cleanliness iko juu, mambo ya hata at least vile mnahudumiwa madaktari na watu wa county unaona wanashikana pamoja, kwa sababu ukiangalia saa hizi hatuko na machines. Wakati budget ilikuwa inafanywa ya 2015 na 2016. Hiyo pesa vile ilitolewa ya kwenda mambo ya hospitali kama machines na whatever na ujenzi expansion, tuliona kuwa inafanyika kwa sababu ukiingia huko unarithika. Alafu mambo ingine yenye niliangalia hospitali kuwa kina mama wenye wanajifungua wanasaidika vizuri sana.
And from that basket that or envelope that we are given, the functions are enormous, functions are much, and we can appreciate that wananchi feels more service of a county government, and therefore they have shifted the expectation more to the governor than the national government.